Hello guys, what's up? There's always that awkward pause between when it starts recording and we know it's
We're
recording.
just kind of looking around like,
I know. Well, you guys know what it's time for. It's time for our monthly house call. Now, you guys know how we do this. It's Twin Doctors TV and BlackDoctor.org doing the monthly house call. And during the monthly house call, we do one thing, and that is answer your questions. There are no questions too big, too small. It can be related to general health, men's health, women's health, surgical health, alternative health. It doesn't matter. We're going to answer your questions. Now, typically what ends up happening is people see that we're doing this, they start to tune in a little by little, and by the end, the questions are flowing. But initially, it's pretty slow. So what we do ahead of time,
I know you're
I'm not done.
That's what I'm trying to wrap up. Like, we already have the questions, so let's go.
What we do ahead of time is we have people send us questions. So we're going to go on ahead and start with some of the questions that viewers have sent us. But if you guys have questions, feel free to chime in at any time. We'll see them. We'll get to them right away. The earlier the better, because the more questions that come in. So, first question we got was in regards to a Mirena IUD. And the patient basically said that they had a Mirena IUD placed in 2015 by actually the best OBGYN in the world. No, me. It was a couple of weeks after they delivered their son. Since then, they've had no bleeding, which most people with the Mirena IUD don't have bleeding. That's one of the things that people really like about it. But for the last, that's fundamental, I know. Looks like for the last 3 days or so, there's been bleeding, and they're wondering whether or not this is normal or not, especially because they have a history of ovarian cysts and uterine cancer.
Well, I think you should break down first of all what the Mirena IUD is. Just really quickly, so an IUD is an intrauterine device, a little T-shaped device that goes in the uterus, used primarily for contraception. There's some that have hormones in them, like Mirena, some that don't. The ones that have hormones like Mirena have a hormone called progestin in it. And progestin is a hormone that your body would normally produce anyway, usually in the second half of your menstrual cycle, and it's the hormone that actually makes the lining of the uterus slough off. So it's the hormone that basically causes you to have your period. And so a lot of people, some people even get the Mirena to lighten their periods, because what happens is when you first get the Mirena, all that progesterone basically cleans the uterus out, so all the lining of the uterus sloughs off. So I tell patients you can bleed for weeks, you can bleed for months, but eventually you will either stop having periods altogether, or you'll have pretty light, pretty short, irregular periods. But, and I think this is getting towards what the patient whose IUD you placed is now having problems. I'm kidding, it normally happens. But when you've had it for a while, you know.
So basically what happens is, like you said, the progesterone in the IUD causes the lining of the uterus to come out. There's no more growth of that lining. There's nothing to come out month after month. There's no bleeding. What tends to happen, though, and the Mirena is good for 5 years according to the manufacturer, and most studies have shown it's good for 7. For most people during that 5 to 7 years, that lining remains thin. There's nothing to come out every month. They don't have bleeding. What happens sometimes, though, is you can get what's called an atrophic bleeding pattern. And basically what happens is that lining is so thin that the blood vessels that are normally covered by that lining are exposed. You can get bleeding from those blood vessels, and bleeding can result. So, long story short, it sounds like you're probably having atrophic bleeding resulting from the Mirena. Best thing to do for that is to do like a 10 to 14 day course of an oral estrogen. It causes that lining to grow just a little bit. You get some covering over those blood vessels again. The atrophic bleeding normally stops. Now, if there's a family history of uterine cancer, you don't want to ignore bleeding, because one of the initial signs of uterine cancer will be abnormal bleeding. But the progesterone in the Mirena IUD helps to protect against uterine hyperplasia, which is precancerous lesions of the lining of the uterus, and cancer of the lining of the uterus. So it's not impossible that you can have a precancerous or cancerous lesion of the lining of the uterus, but it's highly unlikely. So I would do like the 10 to 14 day course of estrogen first. If the bleeding resolves, it's atrophic bleeding, you're all good to go.
And frequently, you may only have to do one course of the estrogen, but you may have to do it like every 3 or 6 or 9 months. You may have to do it every once in a while, because again, that lining will thin out. Also, bear in mind, while that's more than likely what it is, there could be other unrelated causes for bleeding. There could be vaginal infections, cervical infections, abnormal cells on the cervix. So see your gynecologist, get that course of estrogen, but still you should probably get your pap smear if you're behind, make sure that there are no infections, things like that. Hopefully that helps. And if you want a real good gynecologist, you can see Dr. I.
Are we good on our sound? We're
doing a bit of a sound check here, guys, so bear with us. We're getting the look like you may be, you may not be.
We're good?
Okay, we got the thumbs up.
Our
sound
dance
is
for
good.
you.
So our sound is good. All right, so
that was the question. So that was the first question. We got another question.
Any questions popped up before we go to the
MS, remember?
Okay, yeah, right, okay. So we got another question. We'll touch on that real quickly, and then we're also going to talk about multiple sclerosis real quickly. So we got a question in regard to tinnitus or tinnitus. People pronounce it both ways. Patient said, I suffer from severe tinnitus in my left ear, but it traveled to my right ear, which the sounds are so loud and overwhelming sometimes. When I move my head a certain way, the ringing noise goes away. Any suggestions to mask the aggravation and ringing? I'm experiencing it every day, pretty much all day, nonstop. So tinnitus basically is a ringing in the ear. You can have what they call subjective tinnitus or objective tinnitus. Subjective tinnitus means you say you got it, but we can't demonstrate that it's actually there. Objective tinnitus means you say you got it, and we've been able to demonstrate that you have it. When you talk about tinnitus, like we were saying, it's a subject or it's a sound that, like you're getting ringing in your ear. You can have what's called idiopathic tinnitus, very fancy way of saying you have it, but we don't know why you have it. When we don't know what's going on as doctors, we don't like to say we don't know what's going on as doctors, so we use fancy words that make you think we're at least somewhat still pretty smart. Or you can have tinnitus that results from an identifiable cause. One of the most common causes is a viral infection. Upper respiratory tract infections, colds, flu, things like that can cause inflammation of the middle ear. Ringing can result. Normally, though, that's temporary, may last a couple of days, maybe a couple of weeks. You're treated with a non-steroidal anti-inflammatory to tamp that inflammation in the middle ear down, like Motrin, Aleve, naproxen. Or if it's really problematic or persistent, you can even do a steroid like prednisone that again helps to decrease that inflammation in the middle ear. Tinnitus goes away. There can be neurological conditions, though, that are chronic or long-term that can also lead to tinnitus. Multiple sclerosis is one, something we were going to talk about in a little bit. Parkinson's disease, Alzheimer's.
Also, people that are exposed to loud sounds on a regular basis, they also can have tinnitus as well. So, I mean, in generally for people that have an acute cause, like we were saying, a viral infection, upper respiratory tract infection, it's relatively short-lived. Even if you don't treat it, it usually will go away. But anti-inflammatories, things like that, it will go away. But the more chronic causes of tinnitus tend to be chronic, in that they don't go away. Sorry, go ahead.
But again, you can do the non-steroidal anti-inflammatories, Motrin, Aleve, naproxen. You can do courses of prednisone. All of these things help to fight the inflammation in the middle ear that causes the ringing. And then also, you want your doctor, if they haven't already, you want them to investigate to make sure that there aren't other broader neurological conditions at play that can cause the tinnitus. Again,
generally, that's what they'll do if they do the more low-key things like the prednisone and the anti-inflammatories. If those don't improve the condition, then they'll go a little bit deeper. Go ahead, like MRI, things like that.
Yeah, I mean, it depends on what they're trying to rule out, but MRI, imaging of the head, things of that nature. Were there any questions, Renee, or shall we?
Yes. What exactly are the symptoms of hand, foot, and mouth disease, and how long does it last?
All right, so hand, foot, and mouth disease.
You know this one very well.
How dare you?
Did you have it?
Well, one of my kids did have hand, foot, and mouth, yeah.
Wasn't she?
No, I never had.
Anyway,
all right. But anyway, the symptoms of hand, foot, and mouth disease actually are kind of indicated by the name of the disease, hand, foot, and mouth. And so normally you get a rash, and the rash will be on the palms of the hands, the soles of the feet, and you'll get these little blisters in the mouth. It's caused by a couple of different viruses. Most commonly, though, it's this virus called Coxsackie virus. There's a Coxsackie A, Coxsackie B. But like most viral infections, it's time limited. It will resolve on its own. And so normally, the treatment for hand, foot, and mouth is more just supportive therapy, Tylenol for fever and discomfort, Motrin for discomfort, fluids, rest, and it tends to run its course. You normally see it in young kids because part of the way it's transmitted is by hands in the mouth and touching, things that are contaminated and then putting them in your mouth. And so you see it a lot of times in kids and people around.
You also see it in people that are, compromised in some ways as well. And it is more common in pregnant women for that reason as well. But it's one of these horrible sounding things. Hand, foot, mouth disease. Oh my gosh, that's hand, foot, mouth disease. Like you said, it's viral. So
I don't want to lose my hands.
I know. Goes away, so not a huge deal. But if it's hanging off more like a week, so maybe talk to your doctor. But yeah,
and make sure that's what it is too.
And
There are other things.
There are other things can mimic it. There are other things can mimic it that aren't necessarily as innocuous.
So don't make the diagnosis based on Dr. Google. Make sure it's actually hand, foot, and mouth.
Exactly.
Can you talk about stage 4 endometriosis?
Okay, so endometriosis is a condition where the endometrium, which is the tissue that lines the uterus, ends up outside of the uterus. And there are a lot of theories on how this happens. We won't necessarily get into that, but it ends up outside of the uterus. So it ends up on top of the uterus, on the ovaries, in the pelvis, and it's staged basically 1, 2, 3, and 4. Stage 4 is the most severe. So it means that there's distant endometrial tissue. Sometimes it can actually, oddly enough, it can be found in the brain. Yeah, that's rare. It can be found in the brain, it can be found in the lungs, it can be found on the intestines. But stage 4 endometriosis is the most severe endometriosis. Now that's strictly by looking. Now the symptoms of endometriosis can be pelvic pain, painful periods, painful intercourse, things like that. But ironically enough, there's not necessarily a correlation between the amount of endometriosis you have and the amount of pain. So we'll do laparoscopies on patients that have a lot of pain. There's just a little spot here, a little spot there. Or we'll be, doing surgery for something totally unrelated, and this person is covered in endometriosis, and they're not symptomatic. So just because you have stage 4 endometriosis, it doesn't mean that you're going to necessarily have a lot of pain. But a lot of patients with stage 4 endometriosis do have pain.
And so why does endometriosis matter is one question. Well, one, because it causes pain for a lot of people, and that in and of itself can affect your quality of life, and it's troubling. But also, endometriosis is associated with a much higher risk of infertility. Because what normally causes the pain with endometriosis is, like we said, that endometrial tissue is outside of the uterus. And just like it would do if it were inside of the uterus, every month with your hormonal cycles, it grows. And so when it grows, it's growing in an area that it shouldn't be growing. That in and of itself causes pain. Your immune system says, hey, there's this tissue here that shouldn't be there. It attacks it. That causes inflammation. That causes pain as well. And that inflammation eventually can damage the organs that the endometriosis is on. So if it's on your tooth, for example, those tubes can get damaged. Infertility can result.
And I think one really important thing to say about endometriosis is that endometriosis is one of those conditions that you can't necessarily diagnose. Like, you can't see it on ultrasound. Sometimes you can see it on MRI, but you usually have to take a look inside. And so for that reason, a lot of patients feel like they're crazy. Like, they'll go to a doctor and they're saying, I'm having this extreme pain, and the doctors, they go pelvic exam, ultrasound, and say, you're fine. And they feel like, okay, well, maybe it's all in my head. So endometriosis is one of those conditions where you've got to, with any condition, you have to be your own advocate, but especially with endometriosis, because you're going to run into a lot of doctors who feel like, oh, you're not having pain, or your pain's not that bad, take some Motrin, take some Tylenol, it's not that big a deal. And the good thing, I guess there's a good thing about endometriosis is there are a lot of ways to treat it. There's not necessarily a cure outside of menopause or total hysterectomy, but there are a lot of ways to treat it. It can be I was going to say it can be things as simple as, anti-inflammatories just to reduce inflammation and pain, any form of hormonal medication, be a birth control pill, patch, shot, IUDs, those help. The medications like Lupron. There's surgeries that you can do that are not definitive, so they don't cure, but they can buy you lots and lots of time, totally or relatively pain-free. So the point is don't run into that wall.
But one thing you said, and we don't want to talk about it too much because I'm sure there's other questions, but like Dr. I said, it's a tissue diagnosis, which means that it can only be diagnosed by directly visualizing it. So just like, he said you may have the doctor do a pelvic exam and ultrasound, say we don't find anything, there's nothing going on. You'll see the opposite a lot of times. A lot of people come in and say, I've got endometriosis, and I say, well, how do you know? Well, the doctor did an exam and told me. Again, don't let somebody make that diagnosis without actually visualizing and sampling the tissue, because other things could be going on as well. So just like don't let them poo-poo you and tell you it's not based on a physical exam, don't let them tell you that it is based on an exam as well. If you have suspicions that you have endometriosis, a diagnostic laparoscopy, popping that camera in is really the only way to make the diagnosis.
What treatments do you recommend for eosinophilic fasciitis?
Eosinophilic fasciitis. Okay.
So you're going deep on that. So eosinophilic. So first of all, we probably should say what eosinophils are, right?
Yeah. So go ahead. Eosinophils are immune cells, basically. So when you talk about the immune system, you have all of these different cells. We've heard of white blood cells, which help to fight infection. You have lymphocytes that help to fight infection as well, and that help to make the immunoglobulins that fight infection. And then you have what are called mast cells, eosinophils, basophils, a whole bunch of different cells. Eosinophils play a role in
fighting viruses.
Not just viruses, also allergic response. Right. And so oftentimes if you see elevated eosinophils, there's probably some trigger that is stimulating your immune system. It's just like you see these commercials now where they're talking about eosinophilic asthma, right? And they're talking about how in some people asthma is the result of, and I think it's really in most people, but it's the result of exposure to some allergen that is triggering the immune system. The eosinophils are overly active in the lungs. You're getting spasming of the airways, and you have difficulty breathing. Same thing with fasciitis. If you're having eosinophilic fasciitis, basically fasciitis means you're getting inflammation of the fascia. That's this tissue that covers muscles. I don't know where it is. Maybe it's in the feet but wherever. No matter what's happening, you're being exposed to some allergen that's serving as a trigger. There's something your body's been exposed to that your body's saying, we shouldn't be exposed to this. Your body trying to fight that is releasing these eosinophils. The eosinophils will release these proteins and these substances that cause inflammation. You're getting inflammation of the fascia. Pain's probably resulting.
And I was going to say, my guess is that more than likely, you can have eosinophilic fasciitis kind of in a bubble by itself. But you're probably somebody that, suffers from asthma. You may have seasonal allergies, eczema.
All of the stuff that comes with allergies.
And so really the main thing needs to just kind of hone in on what it is that your body is responding to.
And you can hone in on it yourself, or you can get skin testing.
I was going to say allergen testing. See an ANI doctor, allergy immunology doctor.
They can do what's called a skin test, where they will literally tell you what it is that you're allergic to. And then once you know what the potential trigger is, you can avoid it. You can also take things to tamp down the immune system, like Claritin, antihistamines, things like that.
Exactly. But the main thing is find out what it is that you're allergic to. See an allergy immunology doctor. Get skin testing done. More than likely to be allergic to multiple things, but they also kind of grade it like very allergic, kind of allergic, not very allergic.
How the hell do gynecologists know about eosinophilic fasciitis?
But yeah, so that's the main thing. See what it is that you're allergic to. See an allergy immunologist do that. Find those things, kind of isolate those things as best as you can. Some things you can't, like dust and dirt, things like like that, but then need to consider being on medication like Claritin, something that's going to kind of tamp down the immune system, not the immune system, tamp down the inflammatory response.
One more time.
Part 2 of the endometriosis. I damaged my kidney and I'm having trouble with pain. I'm allergic to opioids and doctors can't find anything for pain. What can I use for pain?
Okay, so
that's tough. I was just asking. That's
so I guess first I was going to say take a step back. What is your allergic response to opioids? Because a lot of times we'll have patients say I'm allergic to opioids, and
or
I say,
anything.
Yeah, and I say what happens when you take them? And say I get
I
nauseous.
get nauseous, or I get constipated, and these aren't allergic responses. These are just that's what
normal
the
side
medications
effects.
do. So. For most people, when you're looking at an allergic response to medication, if you're saying I get swelling, my throat swells, I can't breathe, those are true allergic responses. If it's something like I get a rash, that's probably an allergic response as well, but on
But more what they
lesser
call
scale.
hypersensitivity.
Exactly.
It doesn't mean you can't take it.
Exactly. But if it's so please let us know let us know what your response is, because my guess would be that what you're feeling, because a lot of people with opioids, especially, I get nauseous, I get constipated, and those are side effects. I get those too when I take opioids. So
With that being said, if you truly are allergic to opioids and you have kidney problems, the catch-22 there
you
is
can't use non-steroids for the most
Well,
for the most part.
I was going to say most toxins in our body are going to be filtered by the liver and the kidneys, and most medications as well. And so you're limited in terms of what medications you can take if your kidneys or liver aren't working properly. And the next class would be non-steroidal anti-inflammatories like Motrin and Aleve, and you really can't take those to a large extent if you have kidney issues.
And honestly, this is the thing though. Even if you have only one functioning kidney, it's enough. But the thing is, even people that have one kidney, you can take non-steroidals in theory. But the thing is, anything that potentially cause harm to the kidney, you just don't kind of want to go in there. They're gonna get nervous. You don't want to go into that arena.
And so, if you were going to take them, I would have them check my creatinine and what's called my BUN on a regular basis to make sure that your kidneys are
But
functioning.
I think the question should be less what you can take for pain. Because honestly, there's just not a lot of things out there that would be safe for you if you're truly allergic to opioids.
Tramadol is one medication.
But even that's kind of a non-steroidal. That's kind of
Allergic, trouble breathing, vision, trouble vomiting.
okay. So the
Vision
trouble
and the
breathing.
vomiting.
The trouble breathing, that's true allergize, stay away from it. And then honestly, I think the next question needs to be less what you can take for pain, but more what you can do to stop the pain. So if the pain is related to your endometriosis, again, and if you want to share what you've done, that's great. If not, that's fine. But if your pain is related to your endometriosis, you kind of need to take that next step to get out of pain. Treat it because you're kind of stuck in terms of pain medications by and large.
How can I lose weight is one question, and another person is, what is the most important food to have in my diet?
Oh, okay.
So
losing weight, that's your bailiwick. I mean, that's your calorie. But basically, losing weight, there's no secret weapon when it comes to losing weight. Unfortunately, I mean, it really does come down to the two things. It comes down to diet, and it comes down to exercise. And Dr. J likes to tell this humiliating story all the time. But there are a few humiliating stories. But the one about the pager and when we were studying for boards. When we were studying for boards, you're kind of you're in a hole. Like we were eating pizza all night, cookies all night. It's just you and him.
we were like friends. We were stressed.
Exactly.
Most people gain their freshman 15, and we gained
the freshman 50,
50.
50. And so we know of which we speak, and we've been there, and really there's not a lot you can do but diet and exercise.
But knowledge is key.
It's a numbers game.
It's not a numbers game.
In terms of diet, get your rule. There's a good rule.
So there's a very good rule of thumb. Because when we always tell people decrease your calorie intake, people know what that means, but they really don't know what that means. And so what it means is this. Basically, there's this rule called the 3,500 kilocalorie rule, or the 3,500 calorie rule. And so for every excess 3,500 calories you eat, you're going to gain a pound. For every 3,500 calorie deficit you have, you're going to lose a pound.
Because a pound equals
3,500 calories. Yeah, exactly. Look at that, great. All right, I think you heard this. But so at any rate, so what you need to do is you can get what's called the BMR calculator, basal metabolic rate calculator, and it'll tell you based on your sex, age, weight, gender, how many calories you need to eat every day to maintain your weight, not to gain, not to lose. Then, if you subtract 500 calories from that number per day, you're going to be eating, because there's 7 days in a week, 3,500 fewer calories per week. You'll lose a pound a week just doing that. If you want to, instead of subtract 500 from that number and subtract 1,000, now you're at 7,000 calorie deficit per week, 2 pounds per week. In addition, if you burn 3,500 calories a week exercising, you're going to lose another pound. So basically, just remember, for every 3,500 calorie deficit you have, be it a deficit because you decreased your food intake, be it a deficit because you burned calories, you're going to lose a pound, and for every additional 3,500 calories you eat, you're going to gain a pound. Also, I was going to say exercise because you burn calories, but also you build muscle. Muscle burns a lot more calories than other tissue like fat or bone or whatever the case may be. So not only does exercise that builds muscle help you burn calories, the muscle that you develop increases your metabolic rate and burns calories.
And I think that's an important point because when people are trying to lose weight, when they hit the gym, what they do is they get on the treadmill for 2 hours. And so you definitely want to have that balance between your muscle building and your cardio. And so honestly, you want to be in the gym at least 60 minutes a day, 5 days a week, more if you can. But I say at the very least split it 50-50. You half muscle building, half cardio. Because again, like Dr. A, you're going to burn calories with any exercise, including muscle building exercise. But like Dr. J said, the more you build your muscle, the more you're going to burn fat as well. Something else to think about in water. Water's good for your health in general. That's why I carry around this 40-ounce one and drink 2 of these a day. But also, as simple as it sounds, water fills your stomach, you know? And you also want to have fibers. Fibers are good, A, because they make you feel full, B, because they're low in fat for the most part, and C, because they actually get all those bad cholesterol out of your blood.
I was going to say, they bind fat.
Yes.
So if you eat fiber, you don't absorb as much fat from your food. Less fat absorbed into your body means less fat that you form.
Now, there's a side effect to eating the fiber, which you can figure out.
You may become very regular, but there's nothing wrong with that.
It's a good thing.
Add a little flashlight, That's what I was thinking more, but you will become regular. So those are kind of the key things with losing weight. Is, know what your basal metabolic rate is. Cut at least 500 calories a day, 1,000 if you want to lose 2 pounds a week. Exercise at least 60 minutes a day, 5 days a week or more. Make it half cardio, half weight building, lots of water, keep the clean diet and fiber.
Not just exercise, but moderate exercise or more. So people always ask, well, how do I know if I'm, exhibiting moderate, if I'm, what's the word I'm looking for, not exhibiting, but
if you're exercising in a moderate fashion,
exactly.
severe.
So basically they say if you can talk, but you can't sing, it's moderate. If you can't sing, then it's severe. You're really breathing heavy. If you increase your respiratory rate, but you're not out of breath, it's moderate. And then if it takes you about 10 minutes, roughly, to break a light sweat, then again, it's moderate. So, that's, you want it to at least be moderate or more.
And something else I would recommend that I'm not, any fitness tracker, you'd be surprised how much you burn and how much you don't when you're sedentary. Fitness trackers kind of keep you honest with your exercise and with your daily activity, and they just get an app. There are a ton of apps on the phone, but actually track what you're eating. You'd be surprised. Like when I think I'm dieting, and when I track, I'm like, you'd be surprised how much you're eating, and
who's been messing with my track?
Exactly. Who scanned that donut? But anyway, okay, so that's that. What was the second question? Sorry.
It was your the best food, which is
that's the hard one. This is the thing. So there are a lot of important foods to eat. Kind of like we already touched on fiber. Fiber is really good for regularity. It's good for intestinal health. It's good for cholesterol lowering.
Lowers your cholesterol, lowers your diabetes.
So fiber is a good food. I don't know if there's a single one food unless there's a specific thing that you're going for. Foods like, cherries have antioxidants. That's good for inflammation, which can affect everything from your brain to your heart to your joints.
Really, it's about a balanced diet. Like you said, you want to get at least 2 to 3 servings of fruit every day, 2 to 3 servings of vegetables. You want to have some lean meats. You want to have the fiber. So there isn't one food.
But is there, if there's something in particular you're going for, like the best food for blank, let us know.
What is the best treatment options for trigeminal neuralgia?
Trigeminal neuralgia. Okay.
Well, so I guess we start with the trigeminal nerve is because neuralgia is just, inflammation of the nerve. So you have a nerve called the trigeminal nerve. But if they can let us know, is this part of a larger condition? Do they just have trigeminal neuralgia by itself?
Yeah.
So
basically, when you tell me I have neuralgia, like you said, it's kind of a fancy word for dysfunction of the nerve. Now, the trigeminal nerve basically innervates a lot of different structures. And so people who have trigeminal neuralgia tend to find that they have a couple of issues. One, because nerves carry our perception of pain, you tend to have chronic pain. Secondly, you can have muscle dysfunction, and you can have issues related to the organs that the trigeminal nerve is innervating not working properly. Like we said with tinnitus, 9 times out of 10, anytime you have an issue with a nerve, there's going to be a broader issue at play, be it that the nerve is damaged from something like multiple sclerosis, diabetes, be it that there's an underlying neurological condition like Parkinson's.
And that's kind of what I was going to say. A lot of times trigeminal neuralgia is not an isolated, it can be, but if it's chronic, a lot of times it's not. So again, if you've already kind of gone down that workup path and you found that there's something else going on, we can definitely address that. But the first step would be how long it's been. If it's been there for like a week or 2,
the diagnosis has been made.
But if it's something that's been going on for a long time, really the next step is to find out why it's happening. Is it strictly isolated trigeminal neuralgia? In which case there are tons of medications there. Gabapentin, Neuralgia. There are all types of medications you can use for just isolated neuralgia. But if it's part of a larger condition, then you really need to kind of hone in on what that condition is.
What are the good numbers for blood sugar? What good and high numbers?
Okay, well, this is the thing. So when we're talking about diabetes, it really obviously for the most part, the lower the better. So we're not talking about so low that you're symptomatic. But if you're diabetic, it also really depends on your situation. So the numbers that we use are cut off for pregnancy diabetics or gestational diabetics, and for general diabetics, it's a little bit different. And it also depends on the time of day. And it depends on if you're medication, things like that. But
I was just saying, first of all, are you talking about your blood sugar or what we call your hemoglobin A1C?
Well, I'm assuming they said blood sugar. I'm assuming they said blood sugar.
It's blood sugar.
Yeah.
Blood sugar. Okay.
Yeah, but generally, so it depends on if you're talking about if you're fasting and if you're talking about after a meal. Generally, if you're not pregnant, if you can keep your postprandial, so your after meal blood sugar to 150 or less, and we're talking about an hour after meal, that's okay. If you can keep your fasting blood sugar, so before you've had anything to eat or drink in the morning, below like 100, 105, that's okay. If you're pregnant, it's more like 90 for fasting, 120 for an hour after meals. But I think what Dr. J is getting at is a more important point. An isolated blood, you need to check your blood sugar, so I'm not trying to discourage you from doing that if you're diabetic. But an isolated blood sugar here and there is not necessarily the most important thing. It's that hemoglobin A1C.
Right.
The hemoglobin A1C it's a molecule in your blood that kind of lets us know, it's kind of the doctor's secret. So this is your blood sugar, are you sure about that? Because
Basically, that's what your average blood sugar has been over the last 3 months.
4 months. Exactly.
Because an isolated high and isolated low, not a concern.
Right.
But if you're persistently running high, persistently running low, that's the problem. And so for the hemoglobin A1C, we normally tell people if you're not diabetic and we're trying to ensure that you don't get to that point, we want it at 5.7 or less. Right. Normally kind of between 5.7 and 6.3 is kind of when they say you're pre-diabetic or you're, on the verge of becoming diabetic. And then over like 6.3, 6.4, depending on the lab, normally you're going to be considered diabetic. And the values do change from lab to lab.
But if you are diabetic, if the values change from lab to lab, your doctor can have a different goal for you. But generally, if you keep your hemoglobin A1C below 7,
I'm going to say below 7 if you're diabetic.
If you're diabetic,
that's 7, you kind of don't want it above 7.
Why does my stomach hurt so badly after drinking coffee?
Coffee is caustic. This is the thing. Coffee is caustic. Okay, that's number one. But I love coffee. I do, and I'm a black coffee drinker too. And I'm guessing if your stomach hurts, you maybe as well. And it really can irritate the stomach. It can. It does
a couple of things. First of all, coffee can cause heartburn, GERD, and gastritis. So it can cause inflammation from too much acid in the stomach, and that acid can run up into the esophagus, and it causes pain in the upper stomach and where the chest is.
But also stimulates the
I was going to say, so that's one thing. So, you might want to take an antacid before or afterwards if that's kind of pain you're having. But number two, one reason people like to drink coffee is because it makes them regular. It makes you regular because what coffee does is it causes the muscles around the stomach and the intestines to constrict. And so it gets things moving through quickly, and so you'll remain regular. If it's causing a lot of that contractile activity, that can cause pain. Just like when you have diarrhea, or just like when you're about to vomit, you have that pain because those muscles are just going berserk and they're spasming.
But this could also be, and it could strictly be just the effects of coffee. But if you have other things going on, so if you have reflux disease normally, if you have peptic ulcer, if you have some type of inflammation in the bowel, in the gut, the coffee can just be kind of exacerbating, So, like Dr. J said, I think a good idea, if you're black coffee drinkers, maybe kind of cut it a bit. I know that is a sin to people like me who like black coffee. Put a little cream in it, see if that helps. But also taking an antacid will help. But if you find that despite doing these things, it's still causing as much or more pain, see your doctor, because you may have something completely different going on in your stomach. Some of these things like, H. pylori, which causes ulcers in the stomach, antibiotics, they'll take care of it. So it could be that you have something else going on in your GI tract, and the coffee is just kind of exacerbating that.
What is lupus?
Lupus. Okay, so lupus is an autoimmune condition. They call it SLE, or systemic lupus erythematosus. Basically, when we say that anything's an autoimmune disease, what that basically means is it's a disease that results from your immune system attacking your own body. So like we were saying earlier about the whole purpose of the immune system, we have all of these cells, lymphocytes, white blood cells, eosinophils, basophils, all of these different cells, but they all work to do one thing in different ways, and that is to fight badness, for lack of better terms. They help to get rid of precancer cells before they become cancer cells. They help to get rid of bacteria and viruses and fungi that shouldn't be in the body. So they basically are your protection system. When you have an autoimmune condition, what ends up happening is, for whatever reason, the system that's in place to protect you becomes confused and thinks a part of your body that should be there and is a part of your body is something that shouldn't be there, is foreign, and it will attack it. And so, so that's basically what happens with all autoimmune diseases, and then different ones have different characteristics. And so in the case of SLE or lupus, the immune system will attack the nuclei, which are like the power plants of the cells. And every cell in your body has a nuclei. And so it literally can attack any cell in the body. And that's one reason that lupus is so difficult to diagnose. The doctors call it the great masquerader, and that's because it presents so differently in different people. Because if the immune system is attacking your brain cells, for example, you may become depressed, you may become anxious, you may start to demonstrate signs of, I can't think of the word, it's forgetfulness.
Oh, Alzheimer's?
No, but dementia. Thank you. Yeah, that's that. But if the immune system is attacking the blood vessels in your kidneys, for example, you may start to get kidney dysfunction. If it's attacking the blood vessels in the skin, you can get a rash called a discoid rash or a malar rash. So point is, it's an autoimmune condition that can affect and attack any part of the body. More common in women, as are most autoimmune diseases. More common in African Americans. Typically presents, well, you kind of see two windows, but oftentimes 40 and older, but also
in the teens.
I was going to say teens and 20s, yeah.
But it's relatively easily diagnosed. The blood test can be
They can do a test called an ANA, anti-nuclear antibody, because like we said, it attacks these nuclei. So there's an antibody that attacks the nuclei. It's called an anti-nuclear antibody. They can test for it. I think there's different varieties of them, but they know what they're looking for.
And then there are a wide, variety of medication options to treat it as well. So.
Yeah. But that's what it is.
But it is a chronic disease. It can't be cured, but there are lots of options to treat it.
How do you handle migraines that last days at a time?
Well, so with migraines, a lot of times you can just have migraines for migraine's sake. When I was in college, I had migraines all the time. But also migraines can be part of another condition as well. So a lot of times for women especially, they'll have what they call menstrual migraines, where you get migraines kind of leading up to and during your period. But if you just have migraines for migraine's sake, the first thing you want to do is figure out what your triggers are. Some people just have migraines. For some people, the migraines are triggered by stress, or it's triggered by certain things in the diet.
Also by light or bright lights, certain scents.
Just any number of things. So if you frequently have migraines, you want
Sex.
after orgasm.
Yeah.
It's your wife. I'm sorry. That was dirty. That was dirty. I'm sorry. So you want to figure out what triggers a migraine first of all. Second of all, that I think like one of the best medications out there for migraines is a medication called sumatriptan or Imitrex. That's what they call an abortifacient. So instead of treating the migraine, because a lot of times you'll have these prodromal symptoms. You'll have these symptoms before the migraine actually starts. What they call them aura. So you may know it's like flashing lights or weird smells. People that have migraines know what their signs are. As soon as you have that sign of a migraine coming on, you take this medication. You can start it as low as 25 milligrams, bump it up to 50, bump it up to 100, but it works really well.
In addition, there's a medication called Maxalt, because most times they'll go with Imitrex or sumatriptan first.
Right.
So if that's not working, Maxalt is the next one. Also, beta blockers.
That's what I was going to say. Beta
Which
blockers.
are a class of medication used to treat high blood pressure.
And a lot of other things. They treat a lot of things, but they're actually really good for migraines if you're taking these medications like Imitrex, sumatriptan, Maxalt that you take as needed and they're not working. Beta blockers you take on a regular basis.
And the reason for that is actually really interesting because it tells you something about the nature of the disease. You get migraines because the blood vessels in your head are spasmed.
Yes.
And so what beta blockers do is they cause blood vessels to relax, which is why it's good for treating high blood pressure as well. It lowers the pressure in those blood vessels. And so the beta blockers cause the blood vessels in the brain to relax. When they stop spasming, the headache resolves. So that's what migraines are caused by, actually.
And so kind of what I tell my patients, kind of like the quick and dirty list of things. If you know that you have migraines frequently, you know your symptoms, ask for Maxalt, ask for Imitrex, sumatriptan, something like that. When the migraine is first coming on, you want to really pound caffeine. Caffeine helps. You want to pound water, pound fluids, make sure that you're well hydrated. Go into a quiet, dark, relatively cool room. That helps. Non-steroidals, ibuprofen, but go for 800 milligram ibuprofen, something stronger. That will help as well. Chronically, like he was saying, beta blockers, propranolol, that helps also. So if you haven't seen a neurologist already, not a bad idea to see a neurologist. Figure out what your triggers are, and then kind of I do the things we just talked about when the migraine's coming on, or take medications to prevent them.
Okay, so this is kind of a long one. I lost 40 pounds without trying 2 years ago and later discovered that I have a large vascular thyroid nodule. I was told I was hyperthyroid, but am now told I'm not. My family runs rampant with Graves' disease, and my mother, then she typed, are MS and hyperthyroid symptoms similar? Can lab results fluctuate with thyroid condition?
Well, so first of all, with the thyroid, it's not so unusual actually to be told that you're hyperthyroid and then not.
Or hypo.
So just like to take a step back, the thyroid gland is this gland in the neck, and it basically releases these different thyroid hormones, T3, T4, and the thyroid hormones basically act like gasoline for the body. So every cell in your body uses T3 and T4 to carry out its functions. And so if your thyroid gland isn't working properly, be it it's too active or not active enough, it throws everything off. And so in the case of hyperthyroidism, it means the thyroid gland is too active, it's releasing too much T3, too much T4, and your body's just going crazy because it's like you're filling with so much fluid or so much fuel. And that's why people lose weight, because their metabolism is just like, they're just like going 1,000 miles per hour, so they lose all of this weight unintentionally like you did when you lost the 40 pounds. And most times, hyperthyroidism results from Graves' disease. And so it's a condition where you basically will
Make
get
these antibodies.
you make these antibodies. So it's like autoimmune, and you make these antibodies that stimulate the thyroid gland, so it just keeps making thyroid hormone. But what ends up happening is these antibodies eventually burn your thyroid out. So your thyroid's like, I'm done. You've toasted me. I'm done. And so you go from being hyperthyroid with labs that support a diagnosis of hyperthyroidism to hypothyroid, where your thyroid's not working at all.
And you basically have the opposite.
And then you see the opposite.
You gain weight, you feel depressed, you're sleepy all the time, constipation, things like that.
Because you don't have any more fuel. So yes, it's very common to go from hyper to hypo. And most conditions actually cause hyperthyroidism, not just Graves' disease. There's something called Hashimoto's thyroiditis.
Exactly.
Same thing. You're hyperthyroid initially, and then you just burn your thyroid out, and then you're hypothyroid.
But she said she had a nodule. And so a lot of times for people, the nodule will make the thyroid hormone. It's just like
it's called a hot nodule.
Yeah, exactly. It's a hot nodule that makes the thyroid hormone, and they'll either remove it surgically or they will just treat it with medication. But even when they treat it with medication, kind of the same thing can happen. If it's over-treated, you can actually go from being hyperthyroid to hypothyroid. Or if they remove the nodule, then they remove a little bit extra, normal thyroid tissue, and go from hyperthyroid to hypothyroid. So going from overactive thyroid to underactive thyroid is actually pretty normal, and folks may have to go from taking medication to block the thyroid to taking synthetic thyroid medication.
And once she asked about a potential link between multiple sclerosis and thyroid disease,
yes.
You know what? Yes, no,
because
it's mine.
No,
I remember
it's
it's mine.
Yes,
I remember.
but it's auto, like you said, it's autoimmune. Like we talked about, MS is autoimmune, and a lot of times thyroid disease is autoimmune. And so really, when you have one autoimmune disease, you have higher risk for any autoimmune disease.
Especially once your immune system's out of whack, it tends to have a hard time regulating itself. And so people who have lupus are more likely to develop type 2 diabetes, which can be autoimmune. They're more likely to develop MS. They're more likely to develop hyper or hypothyroidism. So yes, they absolutely can be linked. Yeah. Oh, Renee just sent a okay.
No,
Okay. She just pulled out her book.
Yes.
I thought she was telling us your book. Okay.
I will.
Okay.
Please explain sojourn, since we're talking about
Sjogren's syndrome. So Sjogren's syndrome
autoimmune
is
diseases.
What did you say?
Well, since we're talking about all
Yeah,
So
autoimmune,
Sjogren's syndrome is actually another autoimmune disease. And it's an autoimmune disease where actually people, the main symptom people have with Sjogren's disease is that they don't make fluids. They'll have dry eyes, they'll have dry mouth, things like that. So it actually attacks, the antibodies attack the glands that produce these lubrications.
So like the salivary glands here get attacked, so you can't make any more saliva. The lacrimal glands here get attacked, so you can't make any more tears.
Exactly.
You've got chronic dry eyes, chronic dry mouth.
Very rarely do you see people that have Sjogren's syndrome that don't have some other autoimmune disorder. So if you have, rarely, I mean, a lot of times, or you may have like, a lot of them actually have rheumatoid arthritis.
Yeah.
That's very common when it goes to Sjogren's syndrome. Because rheumatoid arthritis is also autoimmune. So yeah, Sjogren's syndrome is just another one of those autoimmune diseases. This one is more focused on glandular tissues.
I actually diagnosed a patient with Sjogren's like 7 or 8 years ago, and her PCP missed her primary care doc, and this woman loved me for life after that. She's like, I can't believe my gynecologist diagnosed my Sjogren's. But it's not a hard diagnosis to make, just because there aren't many things that cause you to have chronic dry mouth and chronic dry eye, unless it's related to a medication. But if you're not on medications, it's a slam dunk diagnosis, and just like lupus and just like most other autoimmune diseases, it can be diagnosed by detecting these antibodies. There should be there's one called SSA, there's another one called SSB. Again, we were talking about those anti-nuclear antibodies. You see them for a lot of different autoimmune conditions, dermatomyositis, Sjogren's, but then, like I said, there's different ones. So there's an ANA that's characteristic of lupus, one that's characteristic of Sjogren's, one that's characteristic of dermatomyositis. But yeah, so that's what it is. It's an autoimmune condition.
what do you think of Herbalife?
Herbalife.
Well, I know that the founder of Herbalife died at like age 40 or 45, so I don't know. What do you think? I shouldn't say that.
No,
no.
You better get my car.
I know. He never did my car. I know that.
Rather get another box of Herbalife.
He just dropped. I know
No.
that.
I mean,
He did.
I don't know. I mean, I guess
And that's a Google. It's true.
I mean, he really did. I guess you have a particular question about it. I mean, this is the thing. So I find that a lot of things like Herbalife and what's this next one now? Level, I think it's called. Or I mean, they're kind of gimmicky, you know. When it comes to like eating healthily and getting the required vitamins and nutrients and keeping your metabolism where it belongs and keep your weight where it belongs, there's no one thing that's going to do it for you. I mean,
The reality is, there's a pediatrician we used to work with, and he used to hate multivitamins. I personally take a multivitamin.
I do too.
But he used to always say, he said, you know what, if you have
balanced
to
diet,
eat a balanced diet, you get everything you need, and he's right. The reason you need things like Herbalife and Amway or whatever it's called is because we don't, and all of us, this applies to all of us, I don't need a proper diet.
Not you, I don't know what you're eating. I'm
No,
just saying
no,
in
but
general.
most Americans don't.
Yeah.
But if you're eating a proper diet, you're getting 2 to 3 servings of fruits a day, 2 to 3 servings of veggies, lean meats, grains, you're eating the proper number of calories, you're exercising, you're getting enough sleep, you're doing all the things that keep you healthy, you probably don't need Herbalife or anything else.
And
Now, like I said, I take vitamins, but what I will say is if you're going to take supplements or vitamins, make sure that they are derived from fruits and vegetables. A lot of them are synthetic. They're made in labs. The body doesn't absorb them as well. So there are I won't say brands, but there are, you can Google, you can find plenty of brands that are made using fruits and vegetables. And if you're going to do a multivitamin, because I do, because most of us don't eat properly, that's the route to go.
Or chewable too.
Liquid or chewable, because
but I guess the thing with, so to answer the question, Herbalife, I don't think it's a bad thing. I just don't think it's necessarily going to take the place of a healthy diet and exercise. I remember our mom, she did Herbalife when we were kids, I remember.
Yeah. She's still here.
She's still alive, so maybe that's a ringing endorsement.
How can you cure leaky gut syndrome?
Leaky gut. Okay, so that's super interesting, actually. Okay, so no, now you're gonna get me excited. No, I'm good. But no, but so basically, this is the deal with leaky gut. God, I'm trying to think of a way to explain it quickly. So basically, our gut is one of the first organs of our immune system. When you think about your immune system, you think about your lymph nodes here, there, everywhere, your white blood cells, your bone marrow, this, that, and the other, all parts of our immune system. But the gut is one of the major immune organs, and people don't realize that. And so basically, you've got all of these immune cells in your gut, and they form this barrier, and they prevent all kinds of garbage from getting in that don't need to get in. What ends up happening with leaky gut is that barrier becomes weak, and all kinds of toxins that shouldn't be able to get into your body can get into your body. All kinds of fats and sugars that shouldn't get in can get in. And the thought behind it is this. And some people will still tell you it's theoretical, and some people say it exists, some people say it doesn't, but most research says that it does. But the thought is this. We have what are called good bacteria in our gut. So there's these two species of bacteria, the Firmicutes and the Bacteroides, and then there's all these different Firmicutes and Bacteroides. One is really good, one is really bad. If you have too much of the Firmicutes, you tend to get leaky gut. Bad things that shouldn't be getting in can get in. If you have high levels of the Bacteroides, you've got a very sound barrier, and you don't have a leaky gut. So basically, when they say leaky gut, they're basically saying that the barrier is weak. Stuff that shouldn't be able to get into your body can get into your body through that gut because you don't have a proper balance of good versus bad bacteria.
But I guess
so I would just say one thing to do is make sure you're taking a probiotic, and not just a probiotic, but a GI probiotic, because there are probiotics for immune health, for vaginal health, for ocular health, and for GI health. So make sure it's a probiotic for GI health. Also, one thing that I do almost on a daily basis is I drink kefir. Kefir is this fermented dairy product, basically, that has appropriate levels of the good bacteria. Again, it's a liquid versus a pill. Liquids are absorbed more readily, and that also can help to increase the number of good bacteria in the GI tract, decrease the number of the bad bacteria, more Bacteroides, less Firmicutes, and less leaky gut as a result. But when you got leaky gut, you feel like crap because you get all the stuff in your body that shouldn't be there.
And one thing they've actually found that I find very interesting, it really makes sense to me to think about it, there is also a really strong connection between leaky gut and things with the brain, specifically dementia, Alzheimer's, things like that. It's top in
the people with leaky gut are more likely to have diabetes, high cholesterol. They are more prone to cancers of the kidney, of the pancreas. Like we said, the brain issues, Alzheimer's, Parkinson's.
Everything,
because
everything that you put into your body is going to be exposed to your GI tract first. Before it gets exposed to your kidneys, before it gets exposed to your liver, GI tract, but it's going to be exposed to your intestines, to your gut first. So it absolutely makes sense. But
a healthy GI tract truly is key to life, and this is going to sound like it's totally unrelated, but it isn't. Floss every day as well. Because what ends up happening is when your GI tract is unhealthy or when your mouth is unhealthy, you have chronic inflammation going on. And inflammation is body-wide. So even if the problem's with your mouth, inflammation goes body-wide. Inflammation damages the body.
But it's not just that. Also, it's the bacteria that are in your mouth. They can actually cause. But I'm saying, but it's not just inflammation. It's actual bacteria. You can go from your mouth into your bloodstream. They can actually cause problems with your heart. So I mean, it's somewhat unrelated, but it's related to all the GI tract. So I guess the way to put a bow on that is brush and floss twice a day, and make sure you're taking a probiotic that has GI appropriate bacteria in it,
or kefir.
I would say both, honestly.
Yeah, or kimchi. The Korean food kimchi.
Although you know that it can increase the risk because it's fermented, it can increase the risk for like esophageal cancer. Don't have too much of that. This kimchi. Don't have too much of that kimchi. But anyway, okay, sorry. Go ahead.
Are there natural ways to get rid of or reduce large fibroids?
Okay, so this is the thing. So fibroids are a huge topic, and if you look at just all women, about 70-ish% of women will have fibroids. They're much more common in African American women. About 80% of women will have fibroids. Black women will have fibroids. But some folks are asymptomatic, but for a lot of people, they can cause a lot of problems. Heavy periods, painful periods, infertility, all kinds of issues. Fibroids are estrogen-dependent tumors. And they are tumors. The tumors are the muscle layer. For the most part, they're benign, but they are tumors.
And by being estrogen-dependent, it means estrogen makes them grow.
Exactly. Estrogen makes them grow. Now, you're going to, everyone, even men, everybody's got estrogen, but everyone's going to have estrogen. But there are certain things that are in our diet and things that are around us that are higher in estrogens. So I tell people, some things you can do that are very simple. If you have fibroids, go organic. Because when things are treated with hormones, it's either be testosterone, estrogen, or a combination of the two. So if you eat organic meats, you're going to greatly reduce your exposure to estrogens. And then just certain foods
Organic
that are,
milk as well.
and then just certain foods in general that are higher estrogens. Things that are soy. So things that have soy or soy based will increase your risk, will increase your levels of estrogen, make your fibroids grow. So those are things you want to avoid.
Weight
as well.
loss will decrease the amount of estrogen your body makes.
That's a huge one. That's a huge one because you have in your peripheral fat, you produce this estrogen called estrone. And so I think one of the, we don't know still, we're going back to that word, idiopathic, we don't know what causes fibroids, but I think a lot of because over the last few decades, you've seen this explosive growth in the amount of people that have fibroids and in the size and symptoms. I think a lot of it is related to our weight as well. Weight loss will go along with it. Diet, exercise, weight loss, going organic, cutting soy, all those things will definitely help to reduce the size of fibroids. In terms of medications, there are medications that will also reduce the levels of hormones, the levels of estrogens, and those will also reduce the size of fibroids. They can be traditional medications, birth control pills, patches, shots, things like that will reduce your estrogen levels. But there are other medications as well. So I don't know what you tried, and I don't know if you're in your 20s and thinking about fertility versus in your 40s and thinking more about symptoms. But there really are a lot of options. But some of the easy things. Stick to organic. It's good for our body in general. I think I'm a huge fan of organic, but definitely stick to organic. Watch the soy.
Well, it's not.
Well, I know. It's just the way it is. Watch the soy. And if your BMI is where it belongs, definitely losing weight will make a huge difference.
If you have sarcoidosis, it goes into remission. What are the chances of it returning?
So sarcoidosis is
Some people say sarcoidosis, but we know it's sarcoidosis.
The lesions are called sarcoidosis, but it's sarcoidosis. Unfortunately, it's what they call relapsing and remitting, so it's a chronic condition.
Another autoimmune disease.
It's autoimmune. And so it's one of those things that it frequently will go into remission, but oftentimes it will come back. For women, it tends to be more remitting and less relapsing, whereas for men, it's the other way around. So women do tend to have longer spells where they're not having symptoms, but unfortunately, it is a chronic condition. It's not something that can be cured, so it will more than likely at some point come back.
While we're waiting for the next question, do us a favor, guys. We're here at blackdoctor.org today, and these guys have these massive social media numbers, over 1 million people like them, and it makes me feel so inadequate. We've only got 10,000.
I know.
850 or something like that. I don't know. I come here, I feel so inadequate. I thank them for having us. So do us a favor. Go to Twin Doctors TV. We're on social media. Facebook, Twitter, Instagram. Why do we have Instagram? I don't know. You gotta check it out. And like us, please, because we feel so inadequate.
I put a lot of good pictures on Instagram.
Yes.
I would encourage you to look at our Instagram.
Right now we've got 10,584. Let's see. Hopefully by the end of this we're gonna have a million.
It's like one of those telephones.
Yeah. We're not gonna get off until
Exactly.
What's the next question?
So, what is enough sleep? Someone said it's 4 hours enough sleep.
4 hours enough sleep.
4 hours for half the night. That's enough
Yeah,
sleep.
exactly. So basically, the average American sleeps 6.8 hours.
6.8 hours.
It's recommended that we get between 7 to 9 hours of sleep per night. And this is the thing about sleep, guys. Not only is sleep awesome, I bought this new bed and I love it. That's how you know you're old and you get excited about the thought of going to sleep. But not only is going to sleep awesome, it's really good for your body. So what people don't realize is when we sleep, it's restorative. It kicks our immune system back into gear. It decreases inflammation. So basically, people who get enough sleep are less likely to be obese because they make less cortisol. Cortisol is a stress hormone. When you don't get enough sleep, your body's like, I'm stressed, I need sleep. The way your body copes with that is by making this hormone called cortisol, which helps you to get through stress short term. But long term is very bad because it increases your blood pressure, your blood sugar, which makes you more diabetic, more likely to be hypertensive, and increases your cholesterol, and increases your buildup of fat, and not just fat, but the trunk of obesity around the waist, which is the most unhealthy fat. Also, your brain doesn't function properly when you don't get enough sleep, so you're more likely to have Alzheimer's and dementia. You're also more likely to have cancers when you don't get enough sleep. And so basically, 7 to 9 hours of sleep per day. You want to make sure that you keep your room between 60 to 67 degrees Fahrenheit. That helps you to get more sleep. You want to use blue blocking glasses. We were just talking about this yesterday, actually. I remember that crazy blue blocker commercial 20 years ago with that guy who was rapping in the little crazy hat. But anyway, blue blockers, if you get blue blocking glasses, Because one thing that makes it tough for us all to sleep is television screens, the screens on our phones, and the screens on our computers emit what's called blue light. Blue light throws your circadian rhythms off. You don't get good sleep. If you wear blue blocking glasses or you put blue light filters over those screens, you don't throw your circadian rhythms off. You get better sleep, and then it's going to say white noise.
Well, white noise, that too. But this is the main thing, though. When they say 7 to 9 hours of sleep, I think people think, okay, if I go to bed at 11 o'clock and get up at 6 o'clock, I've gotten 7 to 9 hours of sleep, or 7 hours of sleep. That's not the case. So I'm going to show you. You can see this is. I'm going to have to get close to the screen. So this is my Fitbit. Okay, not that any fitness tracker will work, but you see it says I got 7 hours and 8 minutes sleep last night. But when you click on it, I was actually in bed from 12:32 until 8:30. It's basically 8 hours. So the point is, it's not just how long you're in bed; it's how long you're actually sleeping. And so to get 7 to 9 hours of sleep, you probably need to be in bed for 8 to 10 hours. So I would recommend, regardless of what fitness tracker it is, get a fitness tracker that tracks your sleep. You would be surprised how much sleep you're actually not getting.
Or use Sleep Score, the app.
Or the Sleep Score app. Never heard of it. But Dr. Renee is saying use the Sleep Score app. So I think she did. Don't you have stock in that one?
No.
No, okay. All right, go ahead. Okay, interesting story. Did you know the guy that's in the Blue Blocker commercials? Did you know he died? No. So actually, weirdest thing, he was on a plane and a bag came out of nowhere and bit him in the head. Was that him? That was him.
No, I thought that was the guy from that was that Australian guy from the infomercial.
What? No, I thought it was Blue Blocker. Wasn't that Russian guy?
Okay.
Yeah, it was the infomercial.
That could have happened twice. Maybe around that. All right.
That blue yeah. No, I don't think so.
Okay, lastly, MS.
Okay, so actually we were asked to come here and speak about MS, but as frequently happens, we just got all off the rails. No, all deserved. But actually, it's kind of along the lines of what we're talking about. So MS, multiple sclerosis, is another autoimmune disease. So if you look at your nerves they're kind of like any electrical wire that you have in your house. It's going to be coated. It's going to be insulated. It's insulated by something called myelin. So what happens with MS is the immune system actually attacks this myelin. It attacks the stuff that both conducts electricity and insulates the nerves. And so again, you have nerves from head to toe. So the symptoms of MS can be body-wide. Like most autoimmune diseases, it tends to be more common in women than in men. Oddly enough, the most common presenting symptom of MS is actually ocular stuff with your eyes. It affects the optic nerve. So you can have double vision, blurry vision, you can have blindness. But again, it can be head to toe, headaches, muscle weakness,
People get
joint pain.
numbness and tingling in the hands and feet because the nerves go into the hands and feet, get the little myelin sheath that's damaged, and you don't get proper firing of the impulses, and you don't feel.
The myelin does regenerate, but again, then the immune system kind of attacks it again, and so it's kind of again, it's one of those like most autoimmune diseases, it's chronic, so it's relapsing and remitting. You have symptoms, then you get better. You have symptoms, then you get better.
If you suspect you have it, they can frequently diagnose it with MRI because MRI will find the little plaques along the nerves where the myelin's been attacked. But they can also do a lumbar puncture, and then there's these antibodies again because it's autoimmune that they'll find in cerebrospinal fluid that really shouldn't be there.
I think what's exciting, so I mean, there are kind of like the mainstay, old standby treatments, basically steroids, anything that modulates the immune system. What's my name right now? Not immune modulators. It's just an I. Come on, the name of the medication. It'll come to me. But any medication that modulates the immune system helps. But they've actually done some. Thank you. They've actually done some research recently, both in England and Canada, looking at stem cells. And it's not, it used to be that a lot of times for stem cells you had to have a donor for the stem cells. They've actually looked at using your own, what they call endogenous stem cells, and there have been actually quite a lot of success with that. So that's kind of, I think, what's on the horizon, so to speak, with MS. And like the patients, like I think they'll say have like 30 people. It's not a lot of people, but like the majority of the people like literally went from almost being like bedridden to actually being able to walk and drive cars, and so it was pretty amazing. So I think that's kind of on the.
But if you have it, you want to do things that help to increase the activity of your immune system or make your immune system healthier. So all of the stuff we talk about, I mean, a healthy life is very simple in many respects. Get enough sleep, make sure you exercise regularly, eat a good diet. Probiotics, yeah, to ensure that you have the healthy bacteria in the gut, because that's like the biggest part of your immune system. That goes a long way. So guys, as always, this has been our monthly house call. We do it once a month. Thank you, Dr. Renee. She wanted us to, not that we wanted to do this, but Dr. Renee. If you do it. So, okay, we'll do it. So there's a book that we wrote, and by we, I mean mostly him, but I helped him. And it's called Everything You Ever Wanted to Know About Pregnancy, in smaller letters, but we're too afraid or embarrassed to ask. It is truly the Bible of pregnancy. They used to talk about that, what to expect, you to expect. I don't even remember. There's some places like that. But this has taken it to a whole new level. So guys, check it out. You can get it on Amazon. You can also get it on our website, www. How do I do that? That's how you know I'm old.
Is there another option?
No, it's just twindoctorstv.com. Also, please, guys, like us on social media. We feel so inadequate. So it's Twin Doctors TV for everything. Facebook, Twitter, Instagram. Like us, follow us. When you like us and follow us, you can always send us questions, reach out to us. We're very approachable. We're cool dudes. We'll answer your questions. But until the next time, we will be here at blackdoctor.org, because you know this is where you can get all the cool information about our monthly house call. This is the place. So remember, blackdoctor.org, Twin Doctors TV, monthly house call. We will see you next month.